2004 when I arrived in India was in the middle of what I would call probably the third biggest chapter in the access to medicines movement after South Africa, after the Doha Declaration. It was when India was required to change its patent law, and people were concerned that once patents started to come into India, the generic industry would die. The supply of HIV drugs, which was predominantly coming from India, the pharmacy of the poor, as it was coined, would disappear. I think the first thing I learned was how the voices of people in the global south are not heard. And I made some of those mistakes of like trying to sort of say, oh, well, you need to do this and this. It was an enthusiasm and wanting to help, but really sort of recognizing actually there are as many valid voices that probably have more expertise on what's happening on the ground in their own countries. Yet the discussion and the conversation gets dominated by somebody sitting at Harvard who's never been in the field, who's doing an MPH or something, and is writing policy. And that for me really struck home. I saw it firsthand. I saw the fact that actually it's the people on the ground who need to be at the forefront. When we first started, it was really just like, how are we going to challenge patents? It was as simple as that. We're going to challenge some HIV drugs, we're going to win, we're going to keep these first line, second line antiretrovirals sort of generic. And that was it. And when we wrote a few little policy pieces where there was efforts to try to change Indians' legislation on certain aspects that would affect drug pricing. And it was really that simple. I mean, it's not simple, but it was narrow. We deliberately wanted to focus because we felt there were so many organizations who were doing so many other things in their organizations that no one was really totally focused on this. And that's why we did become a bit niche in that sense. But eventually over time, it's particularly now that we're in the United States, and the way the issues have evolved, we've learned that there's so many connecting issues. Back in 2004, a lot of patent data was just starting to be digitized, and so India didn't, because its patent office never, it was having to try and really now implement this whole system that was required under TRIPS, and so they would literally post a PDF publishing all the patents every week. And these PDFs were something like they were like maybe a monstrous 1,500 pages, and you would have to literally scroll through trying to find this one patent to see if this HIV patent was in that pile of. And so we were all like literally like trying to sort of find this needle in a haystack, and we spent hours just trying to even just identify which was a patent. And then we had to go and get the patent document from the patent office. Now in India, there are 4 different patent offices in India, and India is no small country. So you had to either go to Delhi, you had to go to Kolkata, you had to go to either Mumbai, and so basically, or Chennai. And so you then had to do that, and you had to go and get the patent. And so this is where we really started taking the patient groups, who were actually the petitioners in the challenges, like the Delhi Network for Positive People. So we take the patients with us, and they would then talk, and we'd start to build a relationship with the patent office. And a lot of this was done really on a shoestring. I mean, we've got a picture somewhere of where we have an intern, Michael Steffen, who's I don't know where he is now, but there's 4 of us, me, Preeti, Vishwas, and mine, like 2 o'clock in the morning, sitting around our laptops, drafting these oppositions, which eventually we successfully achieved to make sure the patents didn't get granted. So just 4 people sitting around a dinner table. It's kind of powerful. We created a civil society activism that was based on practice, not just writing memos and reports. And I'm not diminishing that. That's all important work. Or saying, you can write your law like this. But we had to implement it. And that for me was what was one of the biggest. And that spread across all the other countries as well. And I think people realize that. So what happened in India at that moment in 2004, 5, and 6 was immense for the next 2-3 years of access to medicines. At least it was such an uphill battle and such an uphill struggle that you just didn't have a chance to really sort of sit there and go, oh wow, if the patent got rejected or they withdrew the patent, that would be the moment where you go, great, we've achieved something. But there was always the next one. This is relentless. I mean, you knew, and you also knew in the heart of heart that we're not going to stop everything. You knew that, at least doing the challenge by challenge, drug by drug, whatever. But we were doing as much as we could, given, and at least trying to make sure the law doesn't just slip away into a form that the industry wants. One of the difficulties that did emerge towards 2008 was the civil society shifted in terms of its strategy, and this created a big fissure in the access to medicines movement. Is people realized that patents on newer drugs were going to get granted in India, and so people started to say, well, we need another model, and it was the licensing model where we would try and have public interest type licensing, public health licensing. They believed that if we could get generic companies to, or get the multinational corporations to sign licenses with generic companies, we could then push for other sorts of avenues like compulsory licenses and things like that. So the idea in its theory was great, but I think it was done without really a global North-South civil society conversation. The global South felt differently about it, and I think that was a big sort of pivotal sort of fissure in the civil society movement, and it kind of changed the course of the work. And to this day, some of the issues we see play out during COVID are remnants of that shift in civil society. I feel it kind of halted the initial work that had started in India, and that changed the course of direction a little bit. So we had to recalibrate as an organization. The field had to recalibrate for those of us in the global South who were trying to make sure that the intellectual property system was going to not grow and become accepted, whereas the licensing model was a more acceptable form of trying to intervene. So there's a long history there. I mean, but it's an important part of the changes that change how you approach the work. It struck me as a kind of, well, organizations in the global North are not listening to people in the global South. And this is within civil society. Now, I don't want to be critical, but I think that was my assessment at the time. And I think some part of that holds true. They had their valid reasons. I see it wasn't that they didn't care. They wanted to get more drugs to people. But they thought that was the best way. It was an ideological issue. So as the work started to expand, as people started to look at what was happening in India with the oppositions and what have you, we got in touch with groups in Brazil and in Argentina, and I'll use the story of Argentina because there's a wonderful woman there, Lorena Di Giano, a woman. She's a lawyer, not an IP lawyer, but a lawyer living with HIV, and she was full of passion that I want to do this in Argentina. I want to recreate, what's been happening in India, and I want to build a movement in Argentina. We worked with Lorena, I-MAK did, and I spent some time in Mar del Plata, which is where Lorena lives, and then we went to Buenos Aires. We spent time at the patent office. We spent workshops like helping them to sort of work through the kinds of patents and what each patent does and so on and so forth. And now Lorena is leading probably one of the most active and successful organizations in terms of making sure that people living with HIV, hepatitis C, all the sort of drug pricing issues in Argentina. It really just goes to show that with the right amount of encouragement, resources, support, what have you, you can really build a network. And I feel we built a really strong network of people who are out there challenging patents. We don't even challenge patents anymore. They took it on. So all this stuff is interconnected. And that's, when we talk about how I got into this work, I always knew that knowledge, power, technology was always going to play a role in the future of who controls what. It happens to me, I've focused on access to medicines, but my interests lie broader than that. It's all about really this idea of a sort of relentless economic growth, which is pushed in our modern markets, and that's what's killing the earth. We're consuming things that we don't need to consume, and so on and so forth. And so I see that all in relation to the work that we're doing, even on access to medicines, because they're connected. And so it kind of became more than access to medicines for me, and that's why we wanted to continue. We saw it as racial injustice. We saw it as colonization, as now that we see with so there's always another layer that gets peeled back, and you think, that's what this is.